Our health is intimately linked to the social and economic conditions in which we live. These conditions are shaped by political, social and economic forces and can create or destroy our personal health and well-being. People further down the social ladder usually run at least twice the risk of serious illness and premature death as those at the top. Socio-economic problems are now seen as health problems that must be addressed to ensure everyone has an equal chance at a healthy life. Social determinants of health include the social gradient, or where we find ourselves on the social ladder, unemployment and a lack of job security, the type of transport available to us, early life experiences which start before we are born in the form of support received by our parents, social exclusion, poverty and discrimination, the amount of control we have at work, addiction to alcohol, drugs and tobacco, stress both at work and in everyday life, the type and quality of food to which we have access, our network of social support at home and in the community. This film follows the work of 3 groundbreaking projects in Scotland, Denmark and Slovenia. Despite years of regeneration, the East End of Glasgow suffers from some of the worst health statistics in Europe. A boy aged 15 in this part of the city has only a 50% chance of reaching his 60th birthday.
If you live in a run-down community, you start to feel pretty run-down yourself. And if your mental health isn't great, it can certainly affect your physical health.
While formulating the new local development strategy for the East End, a planning team in Glasgow City Council saw a clear link between planning policy and health.
All the surveys that you do in the East End of Glasgow, it cries out that health is one of the main factors in determining the quality of people's lives. We wanted to create a local development strategy that in some way tried to address those issues.
The impact on health from the urban environment begins on the streets of the East End. Examples can be seen everywhere.
Okay, well here we are in Baltic Street, and down at that end is a community called Determinants. The primary school that was in the Determinant community was closed down, and the new primary school is now at that end of the street. So all the mothers with young children have to walk from there, along this street, and down to the new primary school that's located down there. Perhaps in the past we've designated one area as a residential community, the next area as an industrial community. You sometimes forget that people have to cross those areas.
This daily battle with the environment inevitably leads to an increase in stress, which in turn affects health.
I suppose the environment you live reflects in your own feelings of self-worth and your own self-esteem. And if it's run down and it's in bad condition and it's not looked after and you're not made to feel part of it, then that can have massive impacts on how you feel as a person.
In the local development strategy, I think we've tried to pay much more attention to what these key routes are and what can we do to make those routes better so that people can get from one place to another through a kind of attractive and pleasant environment.
The team realised that to incorporate health as an integral part of the local development strategy, they must understand the day-to-day issues faced by the community. The approach they adopted was original and innovative.
It became obvious that we didn't want to go out there with maps, we'd maybe traditionally done in the past, and the idea of trying to establish what their kind of daily experience was in their daily lives. We came up with the idea of the scrapbooks, just buying people cheap disposable cameras and asking them to maybe photograph a journey that they take every day or their daily experience and identify issues that were important to them in terms of the quality of their life.
The planning team came in and they were really, really good at recognising that people had really valid, strong opinions in their local area and that they have local knowledge that perhaps planners don't have.
More than 50 local residents took part in the scrapbook project, which was organised within the community. The results exceeded all expectations.
Some of them are amazing. The pictures are really eye-opening, issues that you perhaps don't pick up working in the area. Some of these images are just incredible in terms of what people are experiencing in their daily lives.
This is a designated play area for a lot of the local children in this housing development. When the planning application went in from the developers, they have to attach a certain amount of green space, and this is how it worked out. And so this is where we're supposed to send our children to play. It's less than 100 yards away from my home, which is just at the end of this drive. I get to the end of the street and I feel as if I'm just blocked off. It's part of an industrial area. It's so dark at night, it's isolated. I just don't like using it at all.
What we established from the scrapbooks was that people were concerned about where they go, how they feel when they go there. Do they feel safe? Is it well lit? It became obvious that people wanted to be able to walk comfortably in an environment where they felt good about themselves and about where they lived. There is clear evidence now that people's physical environment and where they live and where they are has an impact on their quality of life.
But how will these ideas work in practice? How will the local development strategy create what the planning team call a healthy, sustainable neighbourhood model?
This is one of the maps from our local development strategy, and the circles and the numbers 1 to 5 are what we've called development hubs. We're standing at the moment in Bridgeton Cross, which is number 5 on this map.
Every aspect of the local development strategy builds on the experiences of the residents. A classic example is the establishment and use of green space.
In the past, I think we've treated green space as almost an add-on when we're developing areas. Now we want to make that integral. We've almost described it as infrastructure. So the green space has to function, it has to be active, and it has to feel safe so that people use it.
Access to and use of healthy transport options is another social determinant tackled by the strategy.
Essentially, we want to prioritise walking and cycling above motorised traffic, and the local development strategy promotes cycling and walking. And the consultation that we did, it came through very heavily that people want to walk. We've been through a process of identifying what those key routes are by speaking to local people. We'll look at these key routes and try to improve them to make sure that people can feel safe walking along those routes.
A common complaint among residents of the East End is that they feel cut off from the rest of Glasgow.
I think in the past the East End has often felt quite isolated from the rest of the city, but here you have a train station that's 2 minutes away from the city centre, so you should be able to get anywhere, but sometimes perhaps you don't feel as if you can. The train station is not a very welcoming place, so I think transport contributes to that kind of wider feeling of a quality place.
To be a success, the East End local development strategy needs long-term commitment.
20 to 25 years is the kind of timescales that we're looking at for all of these big projects and the strategy, I feel like, to fully take shape.
Linking the social determinants of health to long-term planning policy is innovative and ambitious.
We've found that, at the very least, incorporating health as a key factor in your planning documents allows you a new way to talk to local people and local communities, and we would recommend anybody, if they're thinking about developing new strategies, to use this approach.
If you can walk down the street and feel safe inside yourself, like you would in other areas, it's just got to have an impact on your health.